Hello, my name is Cynthia Griffith, and I'm the Editor-in-Chief of the Journal for Dermatology Physician Assistants. I'm here today with Angela Saba, who's the Managing Editor of the Journal for Dermatology Physician Assistants, and Peter Young. Peter Young is on our editorial board, and he was just awarded the Dermatology PA of the Year. We're honored to be here with you to talk about how to turn your clinical encounter into a dermatology case report. So, Peter, I know that you've done this a lot. You've turned your clinical encounters into case reports. What advice do you have for the clinician who is seeing many patients, who is wondering, what do I do next?
Mm-hmm. So the process for me starts with seeing something interesting, which could be an exemplary case of a common condition that everyone knows is important, and it happens to be a sort of classic presentation that therefore has teaching value. Or the case might be interesting because it has a component of novelty, might be a rare condition or an unusual coincidence of two conditions. So that's my starting point, is why am I interested in this? And if the answer involves one of those two things, then would it be of interest to other people? Would it confer teaching value to other people? And I, like most PAs in clinic, am seeing patients back to back for most of the day. So keeping track of what cases you might want to write about, for me it just starts with a list that I keep at my desk in a sort of locked, secure place. I write down what I think the diagnosis is and the MRN, so that later I can come back to it. And I think of that list as sort of like an incubator, where sometimes I'm sitting on it for several weeks or a couple of months to either find out if the therapy worked without recurrence after a few months, or if the diagnosis I suspected turned out to be correct. Because a lot of times the things I write on that list end up being not what I thought, or not really case report material, not something others would learn from or be interested in, or the photos end up not being good. So a lot of the cases that I write down on my list of potentials that I just keep at my desk in a locked, secure place, they end up not being write-up material. But after I've found a gem that does seem worthy of writing up, then I basically search the literature, starting with PubMed, for as much as I can find on that topic. And if there was recently a systematic review that was very well done and the topic has been sort of discussed widely, then maybe I don't need to write about it. Maybe enough has been said about it. Or if it is an area of literature that is recently of interest to journals, but there's still a teaching point, like one thing that makes it unique and worth sharing, then I would continue the process of sort of reading more articles about, maybe there's a medication that induced a rash that hasn't been previously shown to be associated. And so it's like an old rash that's been discussed ad nauseum in the literature, but a new association, so that's something worth sharing. And I basically build a list of references, read them until I understand them.
That's what I was going to say as well, is while you're doing that work, you are actually building your discussion and reference section.
Yeah.
So keep track of those articles that you're reading, because you're doing work that is going to be in your final product.
Yeah, and I'm not sure how other people's writing process might differ from mine in this way. I like to build my references as I go, because saving the bibliography for the end, I think, is very confusing and difficult and frustrating. So I basically, if I write a sentence in my introduction or whatever part of the paper, I cite it, and then I put that in my bibliography right away as I'm writing. And so sometimes my my working manuscript in Google Docs, which is the platform I prefer because I can access it from my phone, my iPad, my home computer, my work computer. I can, if I have an idea or realize something, I can immediately go to it and capture that thought from anywhere because it's a cloud-based word processor. I'm not reliant on just being in one location for writing. But my manuscript draft might just be a couple of sentences and then a list of like 5 references at the beginning, because it's like all I have learned is like just this one thing that makes it worth writing about, and I need to sort of trace where I got that information so that later, submitting it with accurate references is smooth and efficient.
You are seasoned in writing and publishing. You've developed this process, and I'd like to segue into a conversation because I feel like there are many derm PAs who are interested in getting involved and developing their writing skills and learning more about how to prepare a manuscript and submit it to a journal for publication consideration. And it all seems very intimidating. And when I speak to someone who expresses the interest but doesn't know where to start, I sort of reassure them, you already have it in your head. And for a case, like you're saying, you've seen the case, you might have taken photos. So I feel like it's already there in their head. It's a matter of going the step to delve into that writing process. And something that JDPA really wants to foster new authors and be a support, offer resources to help them get involved and grow professionally as writers and researchers.
So the JDPA is a resource to our dermatology PAs who have case reports and have clinical cases and are looking at turning those into publishable case reports. So please reach out to the JDPA if you are anywhere in that process. If you have a clinical encounter that you know is novel because you're experienced, but you have no time or ability to write that, we have support. We have other collaborative dermatology PAs in academia that would like to partner with you as a collaborator and write up that case report. If you have just received, as I have, rejections or large lists of reviewer comments on your submitted work and need a breather so that report just doesn't go and sit on a shelf, anywhere you are within that process, the JDPA can be a resource to you to help shepherd you through that process.
And also to be your cheerleaders when that process doesn't go as you expected. And it's really difficult, I'm sure, to receive criticism when you've put so much work into something. It's like you can't look at it anymore. And but as I've said before, the peer review process is there to help authors, and I'm sure as authors yourselves, you've gone through the peer review process, and I'm sure that you've seen the evolution of a manuscript and find that the final publication is better because of the peer review process. And in turn, you acting as peer reviewers have helped improve other authors' work.
I wanted to go ahead.
I'd like to echo what Angela said, that you already have what you need. You have your clinical experience, you have the clinical cases that you're seeing, and when you see things that pique your interest, that's the time to think, should I take good photos of this? I have the HPI already. And then let the JDPA partner with you to support you as you go through that journey to write your first case report. I wrote a manuscript that took 5 years, and I've worked with Peter to write manuscripts in 3 days. So it's nice to have partners to collaborate with, to support you along the journey, and JDPA would like to support our authors, first-time authors, aspiring authors. You can join in a project. Say you're new and you don't have a case yet, but you would like to be involved in the process, reach out to us and we can partner you with someone that's already further along the writing journey.
Yeah, and to your point, Angela, about already having it in your head and basically having the skills by knowing how to describe skin disease and write it up in a note. When you write up a case report for publication, you're basically using the same skills as a physical examination and writing a SOAP note. You're just saying what you saw and sort of building your case to reach the diagnosis, to reach that conclusion. And when I was newer to medical writing, it was very difficult to get the first word on the paper, right? It's like you sort of have this desire for it to be perfect, and perfection can be the enemy of progress. So, number one, I've had to accept, at least very much so in the beginning, I had to accept that my first several drafts would basically not be of interest to most people to read because the quality was going to not be enough that people would enjoy reading it. And so you should accept, if you're a beginner, that it will take several iterations for a rough draft to become something people want to read and that even you enjoy reading yourself. And it takes time. And then secondly, like you said, you already have the skills. If you just say what you see and put that on paper and keep everything objective, scientific writing is basically is mostly confined to objective observations tied with objective vetted information that's related to those observations. So you don't have to really exercise creativity. You don't have to really think up anything when you're writing. You just describe what happened and then learn about the underlying pathophysiology or whatever the focus of the paper is.
Would you also say that you have learned through research and coming up with your reference list, you've learned more about the skin disease or condition that was that you saw in clinic, and you are doing that research and you're reading and you find out even more that you put into a discussion along with the case report, and you're fleshing it out, and you're also contributing to your knowledge.
Yeah, definitely. So I really enjoy writing about things that I know nothing about, because I think the most compelling reason that a person should want to write, that will make them continue to be motivated to write and enjoy it, is a desire to learn.
Yes.
And so if I were just writing case reports about stuff that I understood already, it's like it just doesn't appeal. But yeah, I mean, it's like an adventure of discovery if it's a subject that is like, I've never heard of that. So yeah, I've definitely learned. I've probably learned as much through writing and digging through references as I have through basically hanging out in clinic with master clinicians, like with very solid dermatologists and senior PAs.
The resources that the JDPA has for you include, but are not limited to, how to write a case report that we can send out to anyone who is interested in writing a case report. We have consent information if you have a concern that you need information about how to have a consent for medical writing, as well as editing, writing, manuscript help, questions, a pat on the back, or an encouragement, a little shove to keep going down that writing process. I want to thank Angela and Peter for being here with me. They are just part of the larger team that's here to support you as you work to take your clinical encounter into a publishable case report. Thank you.